my name is Susan Birkhoff, and I am a nurse scientist at Christiana Care, and I typically study different forms of patient-facing technology, and I'm here today to talk to you about the effects of a pre-chemotherapy virtual reality video on anxiety and perceived self-efficacy for first-time chemotherapy patients. So some acknowledgments and disclosures. So this study was supported by the American Nurses Credentialing Center, and it was from the Magna Innovation Prize, and we have no conflicts of interest. So a little bit of background. So as most people can imagine, or if someone has been through it, preparing for chemotherapy treatment is very fraught with anxiety, and a lot of times because you don't know what to expect. And so a team of nurses, oncology nurses at the Helen Graham had this great idea of saying, what if we use virtual reality to kind of really immerse patients in their first day of treatment? And maybe that will help with anxiety and self-efficacy. And so from there, I partnered with them and started looking in the literature, and there really is limited evidence that supports making these customized VR videos that could be an educational reinforcement tool that are aimed at decreasing anxiety and improving those feelings of self-efficacy before treatment commences. So our purpose of our study is we are going to look at anxiety levels and feelings of self-efficacy for first-time chemotherapy patients using this customized pre-chemotherapy video. So our methods are designed, we have a single group quasi-experimental study. Our variables, we're looking at anxiety, self-efficacy, which is another way to say confidence, patients' experience and their satisfaction using the VR. And then our measurements, we're looking at demographics, we're looking at vital signs. In particular, we're looking at heart rate and blood pressure because they're objective measures of anxiety. We're using the state trait anxiety inventory, but the state only, so meaning how anxious patients feel in that moment. The cancer behavior index, and it's the brief form, and that measures self-efficacy. And then we have experience and satisfaction questions. So our population and setting, so we're looking at those first-time chemotherapy patients who are receiving treatment at the Helen Graham. And then, of course, we had different inclusion-exclusion criteria. So some of our demographics and our results. So we enrolled 35 patients. Our mean age was around 62, and the age range was between 37 and 83. But we actually had a nice bell curve. So most of our patients were around like 60 to 65. A little bit of demographic breakdown. So it was predominantly white patients. Education was a nice spread. Gender, it was mostly female. However, Helen Graham sees a high volume of breast cancer patients, and that was actually the most frequent type of cancer the patient had that enrolled into our study. So our results. So looking at heart rate, blood pressure, and the state trait anxiety inventory, and again, it was only state. We definitely we detected a significant change pre-post scores. And then same for self-efficacy, looking at the cancer behavior index form. So looking at those pre-post measures, again, we had a significant change between those two scores. Satisfaction, so majority of patients, almost all of them, there was one that had a meh kind of feeling about it, but almost everyone felt satisfied using virtual reality, and 100% did report that VR enhanced the chemo education they already received, because chemo education is normally given written and orally. And in their experience, a lot of feedback around, being very educational. They found it relaxing. They thought it was helpful. They found it really enjoyable. And there were some people who just thought it was okay. So for discussion implications, the walking patients through that first day of chemo when, they don't know what to expect, the unknown now becomes the known, which of course will help with relieving anxiety and kind of feeling more confident of, now I know what to expect. I know, to face their cancer treatment. Also being immersed in the VR environment really created a mindful state. You can't be distracted. You can't be on your phone. Someone's not tapping you on the shoulder because you have the headset over your eyes, and then you also have kind of like earmuffs over your ears so you can hear it, and you're completely immersed in that environment so you can really focus on what's going on around you. And then also patients can really visualize the care and support they're going to receive from all team members. And what was really cool about our customized video is that we shot behind the scenes at the pharmacy, and so they could really see how the chemotherapy is made, under the hood, and all the care and precautions that go into it. Then they could watch that chemotherapy come back up to the floor, all the safety checks that go into place even when it just arrives at the floor, and then the safety checks that are happening again before it's actually administered. And then they could just see all the different team members and all the care and support that goes into taking care of them. And then the VR video, it wasn't only educational, but it was also entertaining too. There was one lady in particular who her head was going all over the place looking around because it's a 360 video. And I thought she was going to fall off the chair because her head was way behind her, and she just thought it was really cool looking around. And if someone caught your attention, if it was a pump, you could look over and look at that pump more. Someone coming by, you could look at that person, or whatever it may be. You could really look all around the environment. The limitations. So we did have a small sample size, and we did stop recruiting because of COVID. This study was built pre-COVID. And however, even though we had a small sample size, we still did have enough statistical power to look at the effect of VR. And then this was a convenient sample. So of course that could introduce some bias into our sample because maybe certain types of patients were the ones that were interested in VR versus others. And then our biggest limitation is we did not have a control group. And it's really hard to determine, is it the VR itself, like the immersion with the VR, or was it the content, or maybe it was the having more access to some of the study teams who are nurses and could answer more questions. We're not exactly sure, but a control group would help tease out that information. So recommendations for future research, certainly conducting an RCT, because you want to know if VR is having direct effects on desired outcomes. And then using VR is, in my opinion, essentially limitless. It can be tested in a variety of patient populations. It could be used as an educational tool, distraction tool. There's just so many different ways you could use VR. And then one thing we thought about, because first day of chemotherapy, patients had their a loved one with them. And so it would be interesting to study the effects that a VR video maybe would have on caregivers as well. So our conclusion, the study contributed to a limited body of knowledge. I'm using these customized videos to aid in chemotherapy treatment preparation. And also our patients, they really enjoyed the experience. They felt less anxious. They felt more confident to face their cancer treatments after watching our video. And then, it takes a village to, conduct any research study. So here's our village. And these are references. And that's it. Thank you so much for having me. I really appreciate the opportunity to talk about our research study. Thank you.